We estimate there's some 8 to 9 million people that stayed away from the NHS. They did it because they were asked to. They did the right thing, and I want them to know that the NHS is open for them. But that does mean that we need to now focus more than ever on this COVID backlog, and we will shortly be setting out an elective recovery plan. But one of the new things that we're going to do within that plan is this new online service called My Planned Care, which means that every individual that is on the waiting list in England will be able to see where they are, what the average wait is in their trust, and get more information about how to prepare for that procedure, because we just have to recognise that if you are on a waiting list, it can be very you can be anxious, it can be very stressful, and I want to make sure you have maximum information. On top of that, Nick, of course, we are investing a record billions of pounds in the NHS to get through that COVID backlog, and that means new ways of doing things, such as the community diagnostic centres, the surgical hubs, and I just want to make sure we're doing everything we can to make sure, no matter who you are, where you live, that you're getting the care that you deserve.
So just to clarify, Secretary of State, you almost see how far you are down the list, are you? If you go onto My Planned Care, you'll get a sense that it's 2 months off, it's 6 weeks off, or whatever, Secretary of
State. You'll get... first of all, the service will be available later this month, and once you go on it, you will be able to see, obviously, how long, from the point you were referred, how long you've been waiting. You'll be able to see what the average wait for your procedure is at your chosen trust, and from that you will have a strong indication of how long you are likely to wait. But it will also provide other information, such as how you can start preparing for your procedure, such as in some cases you may need to stop smoking, it may be dietary advice, it might be advice on exercise. Because Nick, one thing is to share with you is that I was surprised to learn that around 1/3 of on-the-day cancellations for treatments is because the individual wasn't prepared. When their day came, they weren't prepared, they hadn't had the right diet, they hadn't taken the exercise, they hadn't stopped smoking, and so it had to be cancelled on the day. That's not just bad for them, it's bad for others who could have had that place, and it cost the NHS millions.
And just to clarify, you fear the waiting list, Secretary of State, could be at the range of around 9 million, is that correct?
No, just to be clear on that, the 9 million number I mentioned, so today the waiting list is at 6 million.
Yes.
It will go higher. I couldn't tell you exactly where it's going to go to before it starts falling, and the reason for that is, and that's where that 9 million number came in, is that 8 to 9 million people, they stayed away from the NHS. That's that number.
I see. You'll have had sight of one of the headlines today as we're talking numbers. 500,000 people face delays seeing a cancer specialist. Again, Secretary of State, I would think something that's troubling you and your colleagues, and you would seek to address that.
Yeah, no, absolutely. Cancer has been, in particular, been troubling me a lot. I mean, just first of all, on the current weights, is that, sadly, because of COVID and the focus on that, I estimate actually some 50,000 people stayed away from the NHS that weren't diagnosed that normally would have been, and that's terrible to think about. And if there is anyone out there that is that thinks they need to be seen for this, I can't emphasize enough how important it is to get diagnosed early. But that is also why on Friday, Nick, I made a number of announcements around cancer, made a big speech about some of our new plans, and that includes a new call for evidence to have a 10-year plan for cancer, where we're going to see much more work on prevention, diagnosis, early diagnosis, but also new treatments. So I want to use some of the new things that we've learned about during the pandemic for a benefit, and that's the new technology that we're using on vaccines to see if we can do more for perhaps even some vaccines for cancer, but certainly more treatments.
Can we talk a little bit about the money to back up these ambitious ideas? There is a report today that some of the money that your department was hoping for is not forthcoming from the Treasury. Indeed, the paper uses the words they've blocked the money. Is that correct, Secretary of State?
Now, we've got an excellent relationship with the Treasury, I have to tell you, and I can tell you just from my own experience of having been Chancellor too, that having that good, solid working relationship with the Treasury for any department is really crucial to good delivery. And in terms of the support that my department has received from the Treasury in terms of health and social care, it has been rock solid. I mean, look at the investment that we're making, how we're doing it. So, I've got good partners there, and I've got good partners across government. We're just getting on with the job.
But has some money been blocked, was my actual question.
No. No.
So there's no block of any finances whatsoever?
No. The plans that we set out in terms of financing are completely unchanged in terms of what was set out in the spending review, the extra billions going into NHS and social care, and what we're working on is the plan about how we can make the best use of that. And as I say, so if I can give an example, Nick, like these community diagnostic centres, we've already opened up around 40 of them around the country. There's going to be around 60 more. These are diagnostic centres for tests and scans that are in sort of shopping centres. They can be at football stadiums. They can be in a really convenient place. You can get referred directly to them, but this is a new way of doing things, making sure people get seen more quickly.
As we're talking, there's an interesting point coming via a text from Mike in Birmingham, which is not a million miles from Bromsgrove, as you'll be aware. Can you ask the Secretary of State, will this waiting list also apply to mental health referrals? Does this cover emotional health as well, Secretary of State?
No, the waiting list I'm referring to, what the NHS generally calls its waiting list, is for elective procedures, so surgical procedures and scans and tests. There is, of course,
there's a
what
massive
Mike
backlog in that area, of course, which I think Mike is referencing, Secretary of State.
I was just going to mention that. Mike is quite right to raise that. It's separate to that waiting list. There is a backlog in mental health care. We're putting records amount of investment in mental health care. It is as important as the sort of physical procedures. It's really important to have the parity of care here. They're both equally as important. And also over the NHS's what's called its long-term plan over the last few years, the investment that we're putting into mental care health is going up by some £2 billion a year.
Last couple of points. A couple of new people moving into number 10, both of whom I'm sure you will see later today, and I'm sure you know well anyway. Gita Harry and, of course, your colleague Steve Barclay. What will they bring to the mechanics, the operations of number 10 Downing Street? Secretary of State.
Well, I think this is welcome change, because this is, if you look at that Sue Gray, her interim report last week, she said that things needed to change. She set out the kind of things she thought were needing improvement. And part of that was the relationship between what's called the Cabinet Office and the Downing Street operation. And having someone like Steve Barclay in there, who's incredibly capable, someone who's currently the head of the Cabinet Office, but also to run number 10, I think is a good way to bring that together. So I think these are all a very positive set of changes.
Not doubting a moment Mr. Barclay's talents, some people, such as Jonathan Powell, Gavin Barwell, Lord Barwell, say it's too much to take on. He's a cabinet minister, he's an MP, and now it's this brief as well. Do you think it's too much for any one man or woman to do?
No, I don't think it's too much. Look, it depends who that man or woman is. In the case of Steve Barclay, I think he's more than capable of doing this job, but he will need a lot of support. And so that might mean a few more ministers, perhaps in the Cabinet Office, or it might mean more advisors or staff in number 10. But if you've got the right support, he could absolutely do this job. And I think it's a very welcome change.
You've known Carrie Johnson longer than most. She was one of your team in a previous job. You'll have seen disobliging reports over the weekend that seem to suggest she's almost like a modern-day Lady Macbeth. She runs a court, she influences the Prime Minister, she controls his mobile phone. Is that the Carrie Johnson, or Carrie Symonds, of course, that you once knew?
No, not at all. And these reports, I've got to say, Nick, they really do concern me, because I just happen to think that any politicians, any party, that their partner should be off limits. It's not about the partner, it's about the politician. And by all means, Nick, have a go at me, talk to me, say what you like. Your listeners can do that, but I consider my wife would be off limits. And I think this is very undignified and unfair.
And lastly, Dominic Cummings has responded to the changes at the number 10 we just addressed. Quotes, message from number 10. Our new boss is a pro-Remain lobbyist who said the PM is sexually incontinent, hugely divisive, destructive, dragging the country down, and picked the wrong side in referendum, and then in caps, great. Your response to Mr. I see you smiling. Your response to Mr. Cummings, Secretary... I hear you chuckling. Your response.
I don't know Guto Harry, but everyone that's talked to me about him, told me about him, says he is absolutely superb, excellent, and I very much look forward to working with him.
Yeah, trouble is he supports the Welsh rugby team, Sajid. This is the big problem there. This is what we're going to have to get over with Gito, I'm afraid.
Yeah.
Thank you for your time, Sajid Javid, Health Secretary, appearing here on LBC. What, at 1 minute after 8, the news is next.
On your radio, on Global Player, and...
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom, the Health Secretary Sajid Javid has denied reports that a plan to tackle the NHS backlog in England has been held up in a